Do you know that kidney disease affects more than 1 in 7 adults? That's an estimated 37 million Americans. And guess what? Most of them don't even know they have it. That's because kidney disease often has no symptoms until it's very advanced. By then, it may be too late to prevent kidney failure and other serious health problems. So, what if I told you that you might be hurting your kidneys without even knowing about it? What if I told you that some of the daily habits you have could be putting your kidneys at risk of serious damage? In this video, we'll reveal 7 innocent mistakes that can harm your kidneys according to studies. And don't worry, we'll also tell you how to avoid them and keep your kidneys healthy before it's too late. So, without further ado, let's get started. Number 1. Taking too many painkillers. Painkillers can be a lifesaver when you have a headache, a toothache, or a sore muscle. But taking them too often or in high doses can be bad for your kidneys. That's because some painkillers, such as ibuprofen, naproxen, and aspirin, belong to a class of drugs called nonsteroidal anti-inflammatory drugs, or NSAIDs for short. These drugs can reduce the blood flow to your kidneys and cause inflammation. This can reduce their ability to do their job and cause damage to the tiny filtering units called nephrons. Over time, this can lead to chronic kidney disease, which means your kidneys are permanently damaged and can't function properly. According to the American Academy of Family Physicians, 20% of kidney damage that is caused by medications applies to both prescription and over-the-counter painkillers. And according to a study published in the Journal of the American Society of Nephrology, NSAIDs are associated with a 32% increased risk of chronic kidney disease. So what should you do if you need pain relief? Well, first of all, talk to your doctor before taking any painkillers, especially if you have kidney problems or other health issues. And secondly, use them only as directed and for a short period of time, and try to use the lowest dose possible that still manages your pain or fever symptoms. If you need long-term pain management, ask your doctor about other options that are safer for your kidneys. Number 2. Not getting enough sleep. Sleep is not just a luxury, it's a necessity. Your body and brain need sleep to function properly and stay healthy. But many people don't get enough sleep, either because they have trouble falling asleep, or because they have busy schedules, stressful lifestyles, or poor sleep habits. But did you know that sleep can significantly affect your kidneys? You see, your kidneys work hard 24/7, but they also need some rest. In fact, your kidney function is regulated by the sleep-wake cycle, which helps coordinate the kidney's workload over 24 hours. Studies have shown that people who sleep less than 6 hours per night have a higher risk of developing chronic kidney disease than those who sleep 7 to 8 hours. One study found that sleeping less than 5 hours per night increased the risk of chronic kidney disease by 65% compared to sleeping 7 hours per night. Another study found that sleeping less than 6 hours per night was associated with a 19% higher risk of chronic kidney disease than sleeping more than 6 hours per night. So make sure you get enough quality sleep every night by following a regular bedtime routine, avoiding caffeine and alcohol before bed, and keeping your bedroom dark and quiet. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 3. Not drinking enough water. Your kidneys filter around 115 to 145 liters of fluid every day, of which about 1 to 2 liters are excreted as urine and the rest is reabsorbed by your bloodstream. So, your kidneys need water to do their job properly and keep your body in balance. Without enough water, your kidneys can't get rid of the excess fluid and waste products that build up in your body. This can lead to serious problems like kidney stones and chronic kidney disease, which can eventually cause kidney failure. Kidney stones are hard deposits of minerals and salts that form in your urinary tract when your urine becomes too concentrated. The main cause of kidney stones is not drinking enough water. In fact, drinking more water can reduce the risk of kidney stone recurrence by at least 50%. That's a huge benefit for such a simple habit. So how much water should you drink? Well, there is no one-size-fits-all answer to that question. It depends on many factors, such as your age, weight, activity level, climate, and health conditions. But a general rule of thumb is to drink about 2 liters of water per day, or more if you sweat a lot or have a medical condition that requires more fluid intake. You can also check the color of your urine to see if you are hydrated enough. It should be pale yellow or clear, not dark yellow or brown. Number 4. Eating too much salt. Salt is a common ingredient in many foods and dishes. It adds flavor and helps preserve food. But eating too much salt can be very harmful for your kidneys and your overall health. That's because salt makes your body retain water, which increases your blood pressure and puts extra strain on your kidneys. High blood pressure can damage the delicate blood vessels in your kidneys and impair their ability to filter your blood. It can also lead to other complications, such as heart disease and stroke. So how much salt is too much? Well, according to the World Health Organization, you should limit your salt intake to less than 5 grams a day, which is equivalent to about 1 teaspoon, but most people consume way more than that, especially if they eat a lot of processed foods, fast foods, snacks, sauces, and condiments that are high in salt. So to reduce your salt intake, avoid processed foods, fast foods, and canned foods that are high in sodium. Read nutrition labels and choose foods that are low in sodium or have no added salt, and use herbs, spices, lemon juice, or vinegar instead of salt to season your food. Number 5. Smoking cigarettes. Smoking cigarettes is one of the worst things you can do for your kidneys and your overall health. Smoking damages almost every organ in your body, including your kidneys. It reduces the blood flow to your kidneys and increases the risk of kidney cancer. It also worsens other conditions that affect your kidneys, such as diabetes and high blood pressure. Smoking can also make it harder for you to quit or control these conditions. So if you're a smoker, do yourself a favor and quit as soon as possible. Quitting smoking can improve your kidney function and lower your risk of kidney disease and other health problems. There are many resources and support groups available to help you quit smoking. You can also talk to your doctor about nicotine replacement therapy or other medications that can help you quit. Number 6. Drinking too much alcohol. Alcohol is a diuretic, which means it makes you urinate more often and lose fluids from your body. This can cause dehydration and affect the balance of electrolytes in your blood. Alcohol can also interfere with the function of some hormones that regulate your blood pressure and fluid balance. This can lead to high blood pressure and swelling in your legs and feet. Alcohol can also damage the liver, which is another important organ that works closely with the kidneys to detoxify your body. So how much alcohol is too much? Well, according to the Centers for Disease Control and Prevention, moderate drinking is defined as up to 1 drink per day for women and up to 2 drinks per day for men. 1 drink is equivalent to 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. To protect your kidneys and your overall health, limit your alcohol intake to these amounts or less. And if you have kidney problems or other health issues, talk to your doctor before drinking any alcohol. Number 7. Ignoring the signs of kidney problems. Your kidneys are amazing organs that work hard to keep you healthy, but sometimes they can get sick or injured due to various factors, such as infections, injuries, medications, genetics, or other diseases. When this happens, your kidneys may not be able to perform their functions properly and may show some signs of problems. Some of these signs include changes in your urine color, odor, frequency, or volume, blood in your urine, foamy or bubbly urine, and pain or burning sensation when you urinate. You may also have swelling in your face, hands, feet, or ankles, fatigue or weakness, loss of appetite or weight, nausea, or vomiting. If you notice any of these signs of kidney problems, don't ignore them or hope they will go away on their own. They could be a sign of a serious condition that needs medical attention. The sooner you get diagnosed and treated, the better your chances of preventing further damage and complications. So don't hesitate to see your doctor if you have any concerns about your kidney health. So, by avoiding these 7 daily habits, you can protect your kidneys and keep them functioning well for a long time. Your kidneys will thank you for it. Now we want to hear from you. Do you have some of these habits? Did you know they were harming you before watching the video? Let us know in the comments below. We love to hear from you. Thanks for watching.